Hello and good afternoon. I would like to warmly welcome you all to this fourth webinar of the Relocate, Repurpose and Reorganize project. We have four very interesting presenters today who are going to talk about the future of healthcare ecosystems and their learnings from the COVID-19 crisis. Myself, my name is Anne Richter, and together with my colleague Caroline Raben Mogensen, we are going to guide you through the next 3 very interesting hours. But before we get started, let's have a quick look at today's schedule. We'll start with a brief general introduction, and then we'll go on with all 4 presentations in a row. And then we'll move over to a more interactive part later on, where we'll have individual questions as well as a panel discussion with all the presenters. And I think I don't really have to say much about the practicalities of the webinar. I think we have all been used to that now from this year of digital work. But I'll repeat some of the things. So by default, you're all muted and your videos are turned off, but we still encourage you to interact with us. And you can do that by asking questions or making comments in the chat function. You should find that probably on the right-hand side of the GoToWebinar software that has been opened up here. And we'll then summarize the question and post them to our presenters in the second part of the webinar. And we would also like to interact more directly with you, and by that we are doing that through Menti, and I'll give you more concrete instructions later on. We'll record the whole webinar, and we are going to make that available to all of you probably by the end of next week, so you all have the chance to look at it again if you want to. And that was pretty much it from the technical parts here. So let's move to the more interesting ones, and that is we would like to know what kind of organizations do you present. And here's the Menti link. So you go to www.menti.com and you type in 5818158. And then you should be able to indicate which organization you belong to. So that kind of gives us an impression who is actually participating, so we can also adjust during the presentations a little bit. And that was pretty much it from my side, and I'd like to hand over the presentation to Caroline, who is going to talk a little bit more about the project. Caroline, the floor is yours.
Thank you so much, Anne. And I also want to welcome you very much to this 4th webinar in our 3R initiative, which has been started as a nonprofit cooperation project between a number of different companies that are represented in the next slide, Anne. Yeah, so we've formed a group consisting of a representative from the European Health Property Network. That is a network that emphasizes on bringing together different stakeholders from across Europe in the interest of designing, building and planning healthcare facilities. Then we also have a number of representatives from White Architects that creates resilient architecture in order to support sustainable and resilient ways of living. We have Anne as well as Misha from Walker Project. That's a consulting firm focused on creating value and innovation in healthcare. Finally, we have Flemming and Katarina as well as myself from Raben, which is a engineering, architecture and consulting company with a home base in Denmark, where I'm at the moment. The reason for starting this initiative actually was back in spring, where we witnessed a number of different ways that different countries across Europe and across the world handled and tackled the first wave of the pandemic by establishing either large external facilities for adapting to the high pressure of patients, or other organizations that did that within their current facilities that they just reorganized or replanned in order to cope with the patients. So we were actually curious to understand what was the basis for different ways of strategically attacking the pandemic, and that sort of developed into the project goals that we've had for these webinars that have been run throughout the spring and now till November. So based on the observation that we had in the spring, we decided to start collecting knowledge from our joint networks around the world on different healthcare systems and how they responded to the first wave. Through this collection of cases, we were able to analyze and understand and define the different strategies used to increase hospital or healthcare capacity around the world. And also the learning has given us, and hopefully by the end of today also you, an understanding or a number of perspectives on how to design processes or plan in these very uncertain times. So we also try to highlight what are the factors for success that we've witnessed around the world that have helped different countries cope with some of the effects of the pandemic. And that has brought us to the development of an overall framework that we found that one of the key terms that has also eventually defined the different systems' ability to cope has been resilience. So the capability to maintain and adapt their critical function when faced with a very changing environment based on 4 core factors, which is staff resilience, system resilience, space resilience, and supply chain resilience. And I'm hoping that you believe that you'll get a taste of a bit of everything during the presentations today, where we've sort of tried to lift the perspective from zooming into one of the 4 S's to an overall more holistic framework in terms of trying to understand how the healthcare system as a whole has been affected, but also how these affections have sparked some other new ways of working around the healthcare systems. So this thing brings it back to you, Anne.
Exactly. So one of the results that we are producing in this project is a series of webinars. So we've already had 3 during this year, and some of you have also participated in one or several of these. And today we are at the 4th webinar for this year, and we will also have another one during the beginning of next year, where we kind of summarize the project, launch the field guide, and also the website, where we pretty much summarize what we have identified during the project. And I've already named, we are going to produce a field guide, and that field guide is kind of the synthesis of learning that we have gotten from studying a variety of practical cases. We have now collected over 40 different cases from around Europe, but also Northern America and Australia. And we aim to summarize those and try to identify frameworks for planning and action, and also give an indication of decision points in the field guide. The target group that we want to reach with the field guide is practitioners, so senior hospital managers, directors, board members, hospital planners, policymakers that are related to healthcare and hospitals in particular. And as important building blocks of the field guide, we present the challenges that hospitals experience, the solutions that they have identified, as well as the process towards those solutions, and what kind of effects and outcomes have been reached through these kind of processes and solutions. So this is just giving you a brief overview where the cases come from, and we will summarize everything in that field guide that we then present on a website, and that is all going to be launched in January, and we hope many of you are going to attend then. And with that said, we focus on today's webinar, where we were more have a closer look at, for instance, new ways of working around this crisis. We look at determinants for the functioning of healthcare systems under distress, as well as the support for frontline staff. And with that said, I shift it back to you.